Well, a bipartisan bill on Capitol Hill wants to raise the age to buy tobacco in the U.S. The legislation would change the age from 18 to 21. It's all in an effort to prevent smoking among younger people. Well, Democratic Senator Tim Kaine introduced the bill with Republican Senator Mitch McConnell Monday. Here's what the Senate Majority Leader said.
The sad reality is that Kentucky has been the home to the highest rates of cancer in the country. We lead the entire nation in the percentage of cancer cases tied directly to smoking. Our state once grew tobacco like none other, and now we're being hit by the health consequences of tobacco use like none other. And nationwide, we're in the middle of a completely new public health epidemic that is really threatening our progress in youth tobacco use, the use of e-cigarettes and vaping.
But it's not just lawmakers and the FDA pushing this legislation. Big tobacco, e-cigarette companies, and their lobbyists are actually supporting the age increase. A spokesman for Juul says it supports policies to fight youth tobacco use. Despite the sudden shift from big tobacco, not everyone is buying it. A spokesman for the Campaign for Tobacco-Free Kids says it's more of a PR strategy than a serious effort to prevent youth use. Health groups are pointing to lobbying efforts in state legislations as evidence to undermine any new federal law. Liz Essley Whyte looked into this. She co-wrote an article for the Center for Public Integrity titled Big Tobacco's Surprising New Campaign to Raise the Smoking Age. Liz, thank you for joining us. So what is it, would you say? Is it something different that's being done on the national versus state level? And do you buy this, that it's just a PR effort?
Yeah, tobacco groups are backing federal and state legislation to raise the tobacco age from 18 to 21. And at the state level, what we've seen play out is that in some cases, health advocates have had to oppose these bills that Big Tobacco is backing because they contain provisions that preempt stronger local ordinances. So the health groups really see this as a ploy to pass weaker legislation and preempt stronger legislation.
One state that you looked at was Arizona, and 2 bills have been introduced in the state legislature to change the age to 21 to buy tobacco. One of the proposals is backed by tobacco companies Altria and Juul. How did those companies get involved in the legislation, and why do you think they did? Is it a PR effort?
Yeah, the first bill was introduced, and it was pretty much what health groups have been asking for, strong enforcement across the board. And then an alternative bill was introduced later that raised the age to 21, but also could have impacted some local ordinances and done away with them, some stricter rules on smoking. And that was the bill that Juul and Altria and tobacco interests supported.
So in your report, you point out that health organizations are calling tobacco's lobbying effort at the state level, the state legislature level. It's a bit blitzkrieg. What exactly did you mean by that?
Yeah, tobacco lobbyists have a ton of power at the state level. We looked at lobbying registrations a couple years ago, and there were only 21 companies that had lobbied in all 50 states over a period of 5 years. And Reynolds and Altria, 2 major tobacco companies, were 2 of those huge companies with huge state lobbying presences.
And according to the National Institute on Money in Politics, Altria employed 409 lobbyists in 49 states back in 2017. Reynolds American, another tobacco company, had about 259 lobbyists in 39 states. When you look at these numbers, how do they stack up against other lobbying efforts from other groups?
Yeah. Like I said, they are one of the top 20 companies when it comes to state lobbying, and we've seen Juul really staff up this year too. They're a big vaping company, and they've added a number of lobbyists to push Tobacco 21, and they're also running ads in major newspapers across the U.S. The Washington Post, state capital newspapers are seeing lots of ads in support of these state bills.
You know, as we mentioned earlier, we've got Senators McConnell and Kaine who introduced this bipartisan bill. You don't see a lot of bipartisan effort these days. So, what do we know about the 2 senators' connections with the tobacco industry, and why do you think they're really on board pushing this?
Yeah, they're obviously both from tobacco states, Virginia and Kentucky. McConnell is a longtime ally of tobacco, And health groups are cautiously optimistic about their bill, but they worry that at some point down the line there will be some provisions added in, and they're warning McConnell and Senator Kaine to not do that and to resist the efforts by Jewel and others to possibly lobby on the bill.
Liz Essley Whyte, thank you very much for joining us, Liz.
Thanks for having me.